Dr. Firas Abiad, welcome to the Olayan School of Business at the American University of Beirut.
Thank you.
I'm so pleased to have you here after so many attempts. Let me introduce you a bit. You are the Minister of Public Health in Lebanon since September 2021. You're a surgeon, graduated from the Faculty of Medicine at the American University of Beirut with subspecialized training in bariatric surgeries from the US and UK. You hold an executive MBA from the Olayan School of Business, and we're very proud of that. And prior to that, you were a gastrointestinal surgeon at the AUBMC since 2010. You served as the chairman of the board of directors at Rafik Hariri University Hospital since 2015 till 2021. And your tenure at the Rafik Hariri University Hospital was full of events, and this is the subject matter of our discussion today. And what is so remarkable about your journey over there was the response to COVID at the time, which I hope we'll have the time today to discuss with you. In 2021, Dr. Abiad earned the recognition of the 2020's Man of the Year by the Arab Hospitals Federation for his role in RHUH, especially during COVID-19 pandemic. You are currently heading the Ministry of Public Health at particularly one of the most severe and complex crises in next history, which has started many years ago and is still ongoing. Although the topic of our discussion today will be the Rafik Hariri University Hospital, but you're definitely welcome to reflect on your current experiences as well. Now, I know from previous discussions that the decision to take on the role of the head of Rafik Hariri University Hospital wasn't easy. So would you kindly tell us a bit about what motivated you to take on the responsibility of managing of a failing hospital at the time?
Well, first let me start by saying how I'm extremely happy to be back at the Olayan School of Business. As you know, the American University of Beirut, my alma mater, and I'm a graduate of this business school. And it's always a pleasure, really, to be back in very warm surroundings. So the decision to take over Rafik Hariri University Hospital was not easy. At the time, I was making strides in my professional career as a surgeon, but I had also recently, a couple of years back, had finished my master in business administration from OSB. And I was not at that time having any administrative roles. And I was interested in having an administrative role, but not necessarily a full-time job in a failing institution such as the Rafik Hariri University Hospital. Having said that, there was another dimension that was important at the time, and that is that this is the largest public hospital in Lebanon. It serves a proportion of the population that is the most vulnerable. And because it was an ailing institution, it means that a lot of those people, the most vulnerable population, was not being well served. And therefore, that dimension, which is the dimension of service, public service, was, in my opinion, a very strong, had a very strong role and why I elected at that time to take over that responsibility.
Can you tell us a bit about the status of the hospital once you joined? Obviously, perhaps you did some homework before you decided to join, but what was the status of the hospital in terms of its finances, equipment, financial resources?
So the hospital was passing through multiple crises. In a nutshell, at that time, the public sector in Lebanon was starting to feel the impact of the Syrian crisis. There was a lot of burden on the public sector because of the escalating number of the Syrian refugees. At the same time, the public finances were starting to really strain public institutions. The amount of resources that are made available for those institutions was decreasing. And that meant that institutions where there is a lot of demand on their services, such as public hospitals, but at the same time not sufficient financing of their operations, were at a big disadvantage. And this reflected in their status of finances. In that particular case, Rafik Hariri was in financial free fall. It was losing almost $16 million per year. It was unable to meet its responsibilities towards its employees. Some of them sometimes they would go 4 months without paying their salaries. It was also not able to meet its duties towards its suppliers, and which means also that the suppliers would not then provide the needed medical supplies or medications sometimes, and that means that the hospital would have shortages. So all in all, this made for a perfect storm in the sense that the hospital was in free fall from a financial perspective, from a logistical perspective, from an HR perspective, from a total administrative perspective. And that was the main task. How can we regain some kind of balance, stop the drain, stop the hemorrhage, so to speak, and then see whether we can regain some balance to the hospital.
I remember personally when the hospital was established, I had the privilege of visiting it. It was like state-of-the-art hospital. I'm not a medical surgeon myself, but I was introduced to a type of equipment, a type of system that was unparalleled in Lebanon and perhaps in the region. So very briefly, obviously without putting the blame on anyone, it's not really our intention, but what would have caused the hospital to start as an excellent hospital, excellent equipment and technology, excellent systems, to be in the free flow situation that you were talking about?
So I think that the most important, the two areas, in my opinion, that are very important in the good performance of any system are, number one, the people, and number two, the governance. In my opinion, indeed, when the Rafik Hariri University Hospital started, the aim was that this is going to be the jewel in the crown of public hospitals, that this really is going to be the flagship public hospital. And there were a lot of hopes on this hospital and providing high quality care to the most vulnerable population of Lebanon. Unfortunately, that kind of expectations should have been matched with a very solid governance system and also solid, good administrative practices. When one goes back, and it's always easy to have a hindsight, so to speak, 2020 vision, retrospective 2020 vision is easy. I think that there were a lot of administrative faux pas, so to speak. One of them was the rapid expansion of the hospital beyond a good administrative structure and putting in a good governance protocols. The second is the idea that within the public sector, there are things that are allowed to be done, or there is a bit of a permissive attitude sometimes, that you don't find the same cutting kind of, or the sharp practices in the private sector. And that means that sometimes you are a bit lax in implementing some of the red flags, whether financial, whether administrative, things related, for example, to attendance, to performance, to, and other aspects. I think all of this gradually culminated in the catastrophe that Rafik Hariri was back in 2015.
All right, so let's go to your first days after you decided to join and you took over. So what were your first initiatives, like your first few weeks? What exactly did you do that would really that you reflect on now and you find that to be of value?
So I think that it's very important when anyone takes on such a task, they need to prepare well. And in retrospect, I think some of the things that were rightly done was I really spent time trying to understand this institution. And whether it is by reading all the reports, and there were several big auditors who came. One of them was PwC, who had done an extensive review of the hospital. Trying to speak with people, I met with all of the senior and middle managers within the institution, and we had open discussions, and I was trying to understand from them why the institution was in such a state and so on. And also looking at the numbers, all the financial statements and so on. All of this was trying to have a very clear understanding of the situation and what needs to be done. And in my opinion, what needs to be done was not difficult. I mean, in the sense that it was clear. It wasn't a mystery why the hospital was in such a dire straits. But what was extremely important is from day one to show that the administration had the resolve, and it was willing to sort of not only talk the talk but walk the walk. And clearly to me, that was the main message that needs to be sent before we can start implementing the clear vision and the plan that we had. So my priority from day one was to reestablish order, reestablish administrative order. And therefore, I remember that that was achieved through important gestures. The first one was discipline in clothing. So I remember, I set a rule for myself that I will never go to the hospital without wearing a suit, a white shirt, and a tie. And that was a rule. I always, whenever people would see me, I had to be in the same costume, so to speak, to give, a message about sort of this, seriousness, that, this is something that's serious. And the second thing, which was also extremely important, is the decision from day one to take my attendance. At that time, the attendance in the hospital was all over, and people were showing at different times, and a lot of them were, taking work home, so not necessarily, doing a full, time or schedule, filling their schedules. So I just started as the CEO and chairman of the board by logging on my attendance using the fingerprint. And it was a scene in the initial couple of days, because people would see the manager doing it and nobody else really doing it. And this caused a lot of speculations about what's he doing, is he. But then after 10 days, I issued a decree within the hospital, an administrative order that anybody who doesn't do fingerprinting and have a very clear attendance, then they will not get paid. And also I changed all the schedules from people putting schedules according to what they would think is good, to a fixed schedule, which is either 7 to 3 or 8 to 4. I mean, these were the only two options for people. They couldn't put the different kinds of schedules. And I think that those two things initially were very important in sending a message to everyone, and that this administration is serious. And also the third and last rule that to me was extremely important was no exceptions. And a particular story important about that is when we had an issue with people who had reached retirement age but were still working. And I had come and said, we need to respect the rule, the law. It's a law, by the way, not a rule. Respect the law, and people who have reached retirement age should retire. And then there was a particular gentleman working in the hospital who happened to be a very, very close family friend. And this particular person, he knew all my family, including my mothers and aunts and so on. And the question, the anticipation was, will the rule apply to him as well? So people knew the relation, and they were looking at whether I would break the rule for, what are considered close family. I was adamant that we are going to implement the rule on that particular guy as well. And he didn't make it easy. I remember he went to all the family and he was complaining about my decision and how, this is a show of ungratefulness and a show of lack of empathy to family and so on. But I persisted, and he eventually, he left the institution. And I think that also sent a very strong message to the institution that the administration means business, and that really when we put a rule, everybody has to respect it from the top bottom.
Interesting. It's understandable that usually for a newcomer, or even for an old-timer, when you come up with a new rule, new policy, directive, you'll have pushback. So you have lots of resistance to change. And I know, we've discussed in classes, perhaps in your executive MBA, we discussed issues of resistance to change. My first question is, how did you deal with these pushbacks and resistance to change? And did you find lots of differences between the theory of dealing with resistance to change and the real practice at the hospital at the time?
So indeed, I mean, resistance to change will always happen, but the particular way by which this resistance to change happens is interesting, because when you are working with in a turnaround project in a hospital that is in free fall, people don't sort of express their resistance to change, because the situation is so dire that nobody is going to say we would like to stay this way. Mm-hmm. So everybody agrees that we need to change. What the problem is usually is that people don't agree on what this change can be or has to be. And I think that as much as nobody was willing to resist change, but whenever you come up with a plan to change, people will start cherry picking and say, this works, this doesn't work, and so on. So here I think this is where it is important to then address this using several techniques that I must say are very well documented in business texts. So one of them, I mean, the easiest part in change is that usually the first challenge is creating a sense of urgency. That in a turnaround project is not a problem. Everybody understands the urgency in changing. The problem is having a clear vision. And I think that here the fact that you have a vision where a lot of the others don't, have not thought about it, also makes your job a bit easier. Because whereas you can present something, if the others are not prepared, then their ability to find alternatives are limited. The third part, which is extremely important, is that you have to find allies. So the thought is that, or the thinking is that when you come to a failing institution, everybody is bad. And that is not true. You have a lot of good people, even in failing institutions. Your job as the leader or the administrator here is to find out who these people are, what are their capabilities, and then to make them your allies. And those will be very good change agents for these changes that you want to implement. And then out of those change projects that you have, it's extremely important for you to become opportunistic. In what sense? In the sense that you are looking for creating momentum. You're looking for creating a sense of change. And therefore, you really need to be on the lookout for low-lying fruits. You need to look at the projects where you have the highest chances of success, and then starts with those. So it's you don't manage, and in my opinion, it's not by priority, it's by opportunity. You look at what are the areas where you have the highest opportunity of success, and then zero down on them, put the efforts there, create this momentum, and then you work your way through. And finally, don't do wholesale change. It will fail. In a big institutions, usually wholesale change requires a lot of resources, a lot of effort. Now, if you are coming with a lot of resources, then go ahead. But if you, and most of the times in these situations, you are not coming with a lot of resources, then the idea of incremental change, as you work your way around and creating this coalition, this momentum, becomes extremely important.
Interesting. As you're speaking, I'm thinking about another element in change management, which is making it stick.
Yeah.
And I recognize, and perhaps you can validate this, that there are differences between the private sector and the public sector in that regard. So in the private sector, when some leader comes and he or she institutes a certain culture of change, when that person leaves, perhaps the culture will stay the same. Perhaps the same is not in the public sector. So making it stick, what are your thoughts on this in terms of making it stick in the public sector?
The problem in the public sector is that the culture is already there. So people have an idea about what is the culture in the public sector. Actually, it is one of the reasons why we sometimes, when you are discussing with public employees, you know, why did you choose to come to the public sector? Usually the public sector, the pay is much less than the private sector. And what they tell you is because of security. You know, the public sector has the aura that it is there, you know, it's a low intensity kind of setup where people, you know, the expectations are not as high. You're not in a cutthroat culture such as in the private sector, and really things are a bit more permissive and so on. And therefore, a lot of what we know now is extremely important, which is attitude. You know, a lot of that in the public sector tends to be preset, so to speak. So trying to change the culture from a culture of attendance to a culture of performance becomes quite challenging. Now, can it be done? Of course. And this, in my opinion, relates to the way you administer. So one of the ways I created, you know, certain perks, if you want, a particular one, to give an example, was access to the administration. In what sense? You know, as a CEO, as a general manager, of course, everybody in the institution wants to have access to you. They want to be close by. And here, what I did was give access to the people who are high performance. And then people could see that. And therefore, the message that I was sending is, if you want to be part of the team, the leading team, if you want to be part of the C-suite, so to speak, you need to be a high performance kind of individual. You need to deliver. And if you deliver, you will find open doors for you into the administration. And if you don't, you're somebody who just would like to coast, then you will find it very difficult for you to have access to the administration. And people could see this kind of preference, you know, management or attitude. And, you know, gradually people would understand that if they want to, you know, get what they want, they have to deliver on certain things that the administration wants.
Two important things in the health sector, especially in the case of this hospital, I think that you probably have faced pertain first to patient care and second to the financial resources. Can you provide some examples about how you dealt with these two performance indicators in terms of finance and patient care?
So clearly, you know, financially we were bleeding, and we had to stop it, because without any resources, you cannot then provide the required medications, medical supplies, all the ingredients to be able to provide patient care. Now, the question is, from where are you going to get these extra finances? A lot of the time, and external funding, external financing is not easy to come by. And remember, these troubled institutions, you know, they don't have the reputation so that they could go and access easy money. You know, most of the time, easy money is looking for success stories, and they already choose the winning horses, so to speak. So, but one of the things that you could find in these troubled institutions is that usually there is a large amount of waste within the system. And if you could identify those areas where you have this waste, not necessarily theft, but waste, you know, money that's being spent that you could achieve the same results with much less. As you do that, you start then decreasing your expenses, or saving, if you want, on that. And that allows you to have some funds that then you could invest in certain areas and institute growth. And that was what we did. So when I came, I looked at all of the maintenance contract. And what I discovered is that a lot of those maintenance contracts had been running the same for years. Some of them for equipment, for example, that was no longer necessary or no longer functional, or a maintenance contract that could have been negotiated down. And this is what we did. So by, you know, readdressing this, there was a lot of savings on those contracts. Another aspect was to actually merge certain floors or services, because, you know, we were running with extra people on services that didn't have the right amount of patients. So by merging services, we were also able to improve efficiencies within the workplace. And the reason why these are important is because these are all under your control. You know, sometimes external funding or financing, you have to go and negotiate with external partners, whether it's the government, the Ministry of Finance, whether it is, you know, an external donor. But the ones that are inside your institution, these are all under your control. And it just requires just for you to identify them and then act on the information that you have. Now, as you are creating those resources, then you go towards patient care. And here what is important is to differentiate between two parts. The first one is where there are issues with patient safety. And here, you know, these are crucial. It doesn't matter whether they are financially rewarding or not. They have to be addressed because this is the basics of patient care. If it is unsafe, you have to address it and you have to correct it. But once you are beyond those, you know, these are the non-negotiable parts, then you go and you say, okay, what are the services that can be, you know, be more rewarding? Where are the area where there's a higher need, but also the opportunity to cover some of those expenses? And here, you know, one of the things that people don't understand about the public sector or the public hospitals, how they work in Lebanon, is that people think that these public hospitals get a budget and then they spend from the budget. The answer is no. Public hospitals in Lebanon work the same as private hospitals in the sense that they get no budget, but they have to work and then sort of earn money to spend money. And therefore, if you don't perform, you end up with large deficits and you end up with problems. So that's why, you know, the culture of performance, the culture of delivery is extremely important. Otherwise, these public institutions don't work. Now, this is in contradistinction, for example, for other public departments where they are already salaried, whether they work or not, that will have zero impact on their income, on their salaries and so on. And that's why, you know, they can afford to be, if you want, a bit more loose or a bit more permissive in their performance.
Related to this question is, how hard was it to attract talent? You know, here you are trying to attract medical doctors. I'm talking really about the medical staff. You want to attract medical doctors into a public institution that pays perhaps or definitely less than the private sector. So how did you deal with that?
It was extremely difficult. I think that initially it was really, whether not only medical talents, I mean, sometimes some of the technical talents are also important. Some of the administrative talents are important. And it was really very difficult to attract any, you know, especially talents that have been developed in the sense that it's the finished product. But what you discover is that you do have some kind of hidden gems, if you want, within the institution. But that here means that you also have to play another role, which is the role of a coach. You know, I think that one, especially in an institution that might not be running well, your first impulse is you want to start doing things yourself. But you quickly discover that in a large institution such as Rafik Hariri, you'll be overwhelmed. And actually, this is one of the methods for resistance to change, is for people trying to overwhelm you. So instead, because they cannot tell you no, because you're the chairman of the board, you're the CEO. Nobody can tell you a straight no in your face. But what they can do is overwhelm you with small tasks, sort of the death by small cuts, 1,000 small cuts, as they say. And this is how they stifle you. This is how they stop you. So here, then, you know, what is important is, as I said, to be able to then have people to help you, people who you can delegate. But that means you have to be a good delegator, and it also means you have to be a very good coach. A coach in the sense that, you know, you bring people, you create a good growth environment, you have a no-blame culture as you manage the team around you, because these people are not the finished products. As I said, they are rough gems, and they have to develop. You have to allow them to develop. But that's, in my opinion, one of the most important ways by which you can have talent on your team. You have to create that kind of talent from the people that are already there within the institution.
2019, 2020, major crises hit Lebanon and the whole world. So in Lebanon, we've had the revolution, but perhaps a more significant event that happened at a global scale was COVID-19. So at the time you took a major decision, the hospital administration, I think with the support from the government, obviously, or with something happened where a failing hospital that had, when people thought about the hospital at the time, although they knew that change was happening, they were observing what the new team was doing. Something new happened at that time where you took leadership of combating a major pandemic. And I would say that you did this very successfully. A hospital that was looked upon in a very different way, let me say, earlier now was very esteemed. Can you tell me about this process, this journey?
Yeah. So here I would like to go back to the same question you asked me at the beginning, which is, why did Rafik Hariri Hospital, University Hospital, choose to take that responsibility? Especially in the first 2 to 3 months, it was the only hospital that was taking COVID patients at a time when a lot of the other hospitals flatly refused, whether citing that it might not be covered by insurance or private hospitals, or saying, let the public hospitals take over. At the beginning, a lot of both academic and private hospitals flatly said, we cannot deal with this. I think that the main decision why Rafik Hariri said we will take that responsibility was the same reason going back, which is the sense of servitude, the sense that we are there to serve the people. We are not there to make profit. We are not there to, the main role why this hospital is there is because it requires, its role is to serve the people in their need. And at that moment in time, their need was to take care of COVID patients. Now, the second thing, which I think is also important, is because by that time, the hospital had turned around. Now, we didn't make a major publicity of our turnaround. But by that time, financially, the hospital, which was losing $16 million per year, the loss had gone down to less than $1 million. We had opened the new wards. Our staff were much better trained. We had a lot of the equipment in the hospital had been changed. We had a new radiology suite. We had new wards. We had some of our operating rooms was also new. So we felt that we were good enough to take that challenge. And I think that time has proven that indeed the team that was there and the hospital was good enough to do it. And here, what is important, I think, is, going back at our question about talent. Sometimes, as I said, the talent is not always apparent or is not always on show. There were a lot of talents that sometimes are hidden. And I think that any leader who finds themselves in this crisis, one of the really important things to do is look around you. And a lot of the time, problems. And if you can identify them and the same problems, and if you can identify them and the same problems, and if you can identify them and use them, then the path out of your problem is already there.
I have to say that looking back at what happened during that time, I think we all are indebted to the hospital as to what they did at the time. I know that you lost some people. Many of the medical staff got significantly ill.
Well, actually, Yusuf, the first, although we, the first patient who came to Rafik Hariri, we received in the 21st of February in that year. The first patient, the first staff to get infected was in 29th of May. Yeah. So, it took us 3.5 months before any staff even got COVID. And I think this is a very good reflection of how prepared the staff were. Did we lose staff from the hospital? Yes. Unfortunately, we did lose, not medical staff, we lost administrative staff. And I think that there were a lot of sacrifices. Lebanon lost doctors, they lost nurses as well as we fought COVID. But I am happy to say that, you know, within the multiple crises we were passing through, Lebanon did very well in managing its COVID crisis.
Yeah, alhamdulillah. Let me go back a bit personal now. So how did your medical background influence your management style and decision-making process? So your background is a bit of mix of medical education and practice, but also some business education.
Yeah. I think that I would like to take a lot of, you know, what I later practiced in life to some of the things that I learned in my medical school. And in my medical school, there are two attributes that are important, that have affected me positively, in my opinion. The first one is the scientific method. You know, as a scientist, as somebody who grew in learning chemistry, biology, you know, biochemistry, and so on, you learn how important it is to base your decisions on data, not on feelings, not on what you would like reality to be, but what is in front of you. And I think that, you know, one of the most important capacities that you need to have as a manager, as a leader, is to have sound decision making. And sound decision making, in my mind, clearly is scientific decision making. Is somebody trying to be as objective, as impartial, looking at the data and then trying to make the decision based on that kind of data. The second attribute, which I think is also important, that I have learned in my career as a surgeon, is not to panic in times of crisis. I think that, you know, as a surgeon, where sometimes we are working with, in the operating room, with patients' lives at our hands. And really, you know, what you quickly learn is that if you create a culture of panic and blame, this is not conducive to saving lives. And the best way to approach problems and crises is to be calm under pressure and to be able to create this good relation with the team. Because at the end of the day, you know, despite what people think, medicine is a team effort. And if you're in the operating room, if your nurse, if your resident, if your anesthesia are not performing well, it doesn't matter how good you are as a surgeon, the outcome is not going to be good. And therefore, you know, be able to create this kind of calm under pressure team approach was very important as I applied it to later on to my administrative career. Now, what did I learn from my business school, from my business education? I think the most important thing that I learned from my business education is to use resources and think outside the box. You know, I think to me the MBA was not about the hard sciences part of the MBA. It wasn't about the knowledge I gained, for example, in accounting or in marketing or, you know, in finance. Or it was more about a methodology of thinking, of being able to access resources and utilize those resources to find the best solution of your predicament. And this I think, attribute of being a learner, you know, having no problem in saying I don't know, going into an area, learning, and then applying that knowledge into your predicament, I think was a very important part of my education. And I'm extremely happy that I did my MBA at a later age. You know, I think if I had done my MBA at, let's say, just after I had finished my medical school or my residency, I would have considered it only as a hard science and just adding knowledge. I think the fact that I did my MBA at a later age, and even, you know, doing an executive MBA where you are dealing with people who also are having problems on the go, problems as they were learning, allowed me, and I think allowed them also to develop the approach of, if you have a problem, you can learn as you are dealing with the problem and then discover ways of solving it. And because at the end of the day, to me, management is about solving problems. It is about, you know, finding solutions. And this is the most important thing I got from my MBA.
Linked to what you just said, new leaders need to establish trust and credibility. So reflecting on your past experience in the hospital and perhaps in your current tenure as a minister, what do you think are proper strategies for leaders in order to gain trust and establish credibility?
You know, I also here would like to take that to me being a physician. You know, if you want to have a good relation with your patients, that relation has to be built on two things. First, empathy. You really, I mean, patients would, you know, want to feel that you understand what they're going through, that you really, you, as a physician, you know, a physician that doesn't have empathy, you know, will not be successful. You know, their relations with their patients will deteriorate very quickly. And I think that, you know, being a physician have taught me during the, you know, my professional years, so to speak, is to develop this capability of sitting with people and understanding their point of view, not only taking it from my point of view. The other thing that is also extremely important for a doctor is to have trust. You know, patients have to trust you, especially as a surgeon. You know, as a surgeon, people, when they go under anesthesia, they are at your full mercy. You know, sometimes they might lose their lives. They have entrusted you with the most precious thing that they have, their lives, their livelihoods. And, you know, and trust is something that is extremely important, and it is earned, and it's a big responsibility. And I think that this is also something that I have learned. And whether I am dealing with a patient or whether I'm dealing with an institution, there is this, I think, reciprocal relation where you have to feel responsible for that institution so that the institution, the people in the institution, trust you. And finally, if I could add a last attribute, which I also you know, can bring back to my career as a surgeon, is never be afraid to make the hard decision. You know, I think that as a surgeon, I've also learned that sometimes if you delay taking hard decisions, the situation only gets worse. And sometimes you really need to make that hard decision, and you really need to. And I think that also in crisis, a leader cannot appear to be hesitant and cannot appear to be wavering. And therefore, the ability to take these hard decisions also become extremely important.
It's fascinating that you are mentioning the role of empathy, you know, as a trait for a leader, because we also talk about empathy in leadership, even in non-health types of sectors. Now, when you first assumed the role of a minister, I wrote you something on Twitter, which I don't know whether you read it or not at the time, because I know you were overwhelmed. I said that as a person who knew you from before, I have mixed feelings. On the first hand, I'm happy that a certain public position is filled by a person whom I know is trustworthy, credible, had a track record. On the other hand, I'm afraid. I have a kind of concern, like, you know, like a parent would have, if you don't mind the metaphor. Because I know people who occupy such leadership positions are often put under a spotlight and not in a good way. So if you want to elaborate on this, and particularly perhaps emphasizing the role of the emotional stability of a leader as they want to lead others. You know, there is their inner persona, because they are individuals, they are people after all. So can you tell me more about this?
Yeah, I did read it at the time, Yusuf, and to be honest, I shared your mixed emotions, because it was clearly a big responsibility, a big challenge, and indeed, I think, but it was a big opportunity in the sense of a bigger, it's a bigger position to serve people, and I think that that is, you know, something that to me was always important. But I think that leadership, especially leadership in crisis, is not easy. Remember that crises are, in general, environments of low trust. Why? Because there is a crisis. I mean, you know, when you have a crisis, people even, there is a high level of self-doubt, not only doubt others. You know, everybody is doubting everything that happened because they could see the outcome. They are living the outcome of events as you know. And it's not easy when people are passing through these very difficult times. And usually the leader in those difficult times is the one where there is, as you said, the spotlight, and there is a lot of things to blame, not to celebrate. You know, most of the times are crises, and remember that, you know, usually, as they say, it never rains but it pours. Crises tend to attract other crises as well, and once you go into one, it's very easy to fall into the other crisis and the third crisis and so on. So I think from that aspect, you know, people who want to lead in this extremely difficult time, they have to have a lot of emotional stability and emotional strength. Now, in my case, I think that one of the things that helped is that I am a natural introvert, and therefore a lot of the strength I have come from inside. I am not somebody who is very much attentive to, you know, sometimes the external environment, to the degree that sometimes I am accused of being tone deaf, if you want, or sometimes people might you know, believe that I don't listen to, let's say, criticism or other opinion. I usually do, but I am somebody who probably because of my introversion value a lot my deep thinking and deep emotions. I think that has given me some strength. The other thing is that also one of the things that I have learned is to create around you a circle of good friends, good companions, whose main interest is your well-being and especially your emotional well-being. And I think that, you know, this, you know, companions, what is important is not that they are involved in your business or in your day-to-day life, but in you personally. And I think you don't need to have a large number of those very close companions. Sometimes one or two might be sufficient. But these are the ones you lean on. These are the ones who support you as you're passing through these difficult times. And indeed, I think that anybody who has those people around them are indeed very rich.
Are you naturally optimistic?
I am. I think that, you know, look, you know, even in anybody who is pessimistic will not take any endeavor in their lives, because you're always thinking that these you know, endeavors will fail. So I am an optimistic person, but at the same time I play not to lose. So I think that these two attributes, if you want, are important to balance each other. So although I am optimistic, but I am not cavalier in how I approach things. And I tend to be calculating, and I tend to be very much sort of risk conscious. And that allows, I think, in my opinion, especially in times of crisis, because in crisis you don't have visibility. And if you are cavalier, you're going to jump off a cliff very clearly. But if you are optimistic but cautious, it allows you to make the slow progress that journeys through these muddy environments require.
Well, we talked a lot about crises, which really describes very well our situation for the past 30, 40 years in Lebanon. And perhaps in the past 5 to 7 years at a global level, and, you know, in terms of the successive healthcare crises and political crises, wars, and all of that. But one other thing that is very relevant in the case of Lebanon and many parts of the region is not only that we live in a context of crises, we live in a context of lack of proper transparency, perhaps corruption. That is not only a hallmark of the public sector, but also some aspects of the private sector as well.
Correct.
So even if you operate in the private sector, you have to deal as a leader with individuals who you know, who are either amoral or, you know, straight out immoral. And I'm sure that any leader in a position, whether in the private sector or the public sector, are often faced with situations where they have to make decisions that are laden with ethical dilemmas. So can you tell me a bit about these, how you deal with these issues, in terms of really keeping yourself whole, given all of these challenges?
So I think that managing in the gray is something that is a daily, reality in our part of the world. You rarely have these clear black or white situations, and there's always these ethical dilemmas that you're talking about. I think to be able to navigate them, it is extremely important for one to have a very clear idea of their values and what are the things that within that system of values, what's permissible and what's not permissible. Now, in my experience, I have found it easier to abide my system of values than to have a selective approach. I found it easier internally and externally because, once you are somebody who walks the line, so to speak, people understand that, and then even their expectations from you adjust. So they know that you are somebody who is going to say no. And with time, they stop asking you the question. And you find that it became easier because they know that you're not going to say yes. And I think that it is extremely important for you to draw lines, and come what may, you have to adhere by those lines that are very clear. Like, for example, the decision I took when I took over at Rafik Hariri, when I said everybody who is at the age of retirement have to go. It meant that somebody very close had to go. Fine, we will have to deal with that. Now, having said that, it also doesn't mean that people should be rigid and should not be have some kind of flexibility. And sometimes it is true. You have to take one step backwards to be able to move 2 steps forwards. Now, how do you decide when those situations? I think it's very difficult. I think these, if they happen, they need to be infrequent and far away from each other. I think if you're doing it on a daily basis, then definitely you're doing something wrong. But I do understand that sometimes life is not always ideal, and difficult decisions sometimes have to be taken.
A medical surgeon, an administrator, a minister, an experienced person in various administrative roles. And I will add to that an avid reader, because I know even after you graduated, either as a medical doctor or as from the executive MBA, you still read a lot. And I'm always amazed by the degree of touch that you have with the most recent leadership thought and management practice. So based on all of this background, what would be your advice to future leaders, aspiring leaders, as they want to grow in their own organizations or grow their leadership potential?
I think they have to acquire an attribute. If they don't already have it, they have to have it, which is to be a learner.
Yeah.
I think that the most important attribute for me has been the love to learn new things. And by the way, there is something that is extremely important in this learner mentality. It is to admit that you don't know. You cannot, if you believe that, if you don't admit ignorance, you're not going to learn. And therefore, this admission of ignorance, admission that there is something that is additional out there that you can acquire in knowledge, is something extremely important. And by this admission of ignorance, if you want, it also allows you to fight what, in my opinion, is the most important impediment to being a good leader, and that is to have a high ego. I think that people who have a high ego, whether it is in the sense that they believe that they know everything or they can do everything or they're always right, they will not have a good career as as a leader, or at least they will not lead the people into a good place. And I think that being a learner and being somebody with a very low ego are two things that, in my opinion, would be extremely important for anybody who wants to grow as a leader.
My final question, and please include anything that I did not ask you about and that you want to share in your answer. In hindsight, what things you would have done differently, whether at Rafik Hariri Hospital or whether now in the ministry? What challenges you faced and you wish you had the opportunity to do that again? And related to that question, what's next for you? Do you aspire, do you look forward to going back full-time medical surgeon, or have you thought about this, life post-ministry, if you don't mind the question?
Of course. So I think that the thing that going back in both my positions at Rafik Hariri or at the ministry, I remember the anxieties of the first days. The anxiety of knowing that you have taken on a very big responsibility. And an anxiety that sometimes can lead to a high level of irritability, or sometimes to be, sometimes even you might be unkind to yourself and to the people around you. I think these are the periods of time where if I had a way to go back and talk to myself, and find a way to tell myself to be a bit more calm and to trust, that things will move in the right direction, and to be sort of more trusting in the way things are. I think that would be really the most important thing I wish I had done differently. I think I would have saved myself a lot of wrong decisions or wrong behavior, let's say, that later on I was able to correct, but I wish I could go back and correct them from the beginning, not later. For the future, I have thought about the future. What I know is that, once I finish from this role, I'm going to take a long vacation. I think months, very clearly. I haven't thought anything after that, but definitely I'm very much looking forward to those months of vacation.
Dr. Firas Abiad, thank you very much for this opportunity. I really enjoyed our discussion. I wish you good luck at a personal level. I wish the best of luck to the ministry, and definitely I wish the best of luck to the hospital as well, because we have a lot of emotional attachment to this institution that has been serving the people of Lebanon and the region in an excellent way, and I wish the people of Lebanon the best. Thank you very much.
Thank you.